meet Felix. Is a guru in the world of academia. Is someone who actually inspired me a lot to join the world of academia. Is someone who has guided me into the research world, and we have done a lot of work together. And I will also want to recognize the presence of some of the international students that we collaborated together. And on call, we have students from the University of Prescott and Federal University in Nigeria. These are the people we work together. And also there are some students from University of Rwanda. So these are the people that we have been working together and we have been collaborating. I'm so happy today, and I'll be happy to share with you what I know on this. But then there are people on call also that they are my seniors that we shall actually be engaging, and as we go along, they'll also be answering the questions here in our call box. Thank you so much. So for today's engagement, I'll be taking you through how to write and publish a high impact case report. And I'm going to make this statement: writing and publishing a case report is actually the easiest way to actually start your publishing career, especially for students who are planning to join the world of academia. It's actually easy, and it's just like how, especially for a student that has been doing their clinical work, at least at some point you've ever written a case report to your consultant to mark. That's actually the case report. But in this case, the only difference is you're going to inform the world, you're going to inform the people in academia about your work. So the work should actually be new. We're going to see what it takes to write a case report. Yeah, I think we can go to the next slide. So at the end of this talk, what we shall cover in this next hour, we shall actually talk about why case report matters. Why is supposed to write a case report? Okay, and I'll take you guys through section by section walkthrough on what you need to write a very high impact case report. I'll be focusing more on the care guidelines, because this care guideline is just actually the guide, that entails everything that's supposed to be put in the case report. It's actually like a guide, and it tells you what to include in your case report, because most of the journal will actually, this is the first thing that most journal look for, whether you follow the care guide or not. Yeah. Then we shall actually talk about a lot of ethical involvements when it comes to case report. I will tell you when to use patients' pictures and everything. And I will let also know that when you talk about case report doesn't require you to actually seek for ethical consideration or approval from your ethics committee. And that's how easy it is. But when you talk about maybe case series, the difference between the two is case series involve many patients, So when you're doing a case series, you may need the ethical approval. But when you talk about case report, there's no ethical approval that is required. But still, you need ethical consideration, because you don't share a patient's photo. You don't just share a patient's case online without seeking for, the content to publish. So we shall talk about that a lot. Then most importantly, we shall talk about the journal selection, or the pitfalls. Most of the people, after writing a case report, they just submit to any journal. This is one of the reasons for rejection. Each and every journal has its own audience that you need to target. When your case is on cardiology, you're going to publish to a cardiology journal, okay? Because if you publish it to a different, or submit to a different journal, probably it's going to be rejected. Yeah. Let's go to the next slide. Yeah. So why case report matters to the top researchers? Maybe I need to first define what case report is. As simple as it's defined, case report is just a detailed report of patient symptoms, signs, disease, treatment, and a follow-up, okay, of an individual patient. I want to put the word individual patient, just a single patient, because if it's more than one patient, it becomes something else, and that one is a case series. In case report, we usually describe something fascinating, something unusual, something novel, that will inform the academia, that will inform practice, something interesting to the clinician, okay? So that's what I meant by novel, okay? So it's like providing many new ideas in medicine, okay? So why case report matters to top researchers. In this case, I may not only be talking about top researchers. I've already mentioned that for people who are planning to join or people who are new in the world of academia, writing and publishing a case report is the easiest way to start your publishing career. You know, case report is very important in CPD or in teaching, in medical education. It's very important. Okay, it's even important in updating literature of the uncommon conditions that we usually see, especially in low research setting. You know, so case report is still very important, and it's just a matter of documenting those fascinating cases that we usually see. I believe most of our clinicians, there are times when you are doing the word round and you come across this interesting case and you ask yourself, wow, this case seems to be interesting and fascinating. What should I do about it? But because maybe you don't know how to go about it, just the case just slipped like that. But otherwise, if you have written it down, probably you'd actually change maybe clinical practice. Yeah, so that's how important case report is. Yeah, let's go to the next slide. Yeah, so what makes a case report publishable? Before I talk about this section, I would like you to know that not every case is worth writing. Okay, not every case is worth writing. Okay, so what makes this particular case publishable? It's a very important question. Okay, because at the end of the day, before you decide to write a case report, first ask yourself as a clinician, after writing this case, what difference will I make? How is this case that I'm going to write differs from the one that's already been published? This is a question that each and everyone that is planning to write a case report should ask. Okay, so the case that is publishable, number one, should actually be a case that is so novel. Some case it is very rare. Now you can talk about rare association, rare drug reaction, rare imaging findings. Not just that the case is rare, and the new case that you're going to find on Word might be new to you alone, not new to the whole academia world. So you should really need, after getting this case and you feel like it's novel, the first thing you need to do is to go online and read a lot about this case and see what I've already documented on this case. That's number one. So number two, a real diagnostic challenges. I'm going to tell you about our studies that I've done with students from Nigeria. Like a real diagnosis challenge, you really see this case, but you can't diagnose. Can actually be because of limited resources, or maybe because of the lack of knowledge. So this is how you can actually present the case. So you can actually present the case because of its unusual presentation or misleading tests that delays the diagnosis. Then another one is the case that is actually gives a very clear clinical message. That one case that will give clinician a very clear message. Okay, that's the case that gives a single generalizable takeaway that every session of a report supports. So it's very important to interest yourself in case those cases like that. Another one is maybe a case that can actually change uh, the clinical practice. I've always seen, during word round, we do a lot of assumptions when we're making a diagnosis. But before you decide to write a case, I might say that the easiest time or the best time for starting to write your case is when you've identified the patient and the patient is still with you on your ward. You can't write a genuine case when the patient has been discharged. I'll tell you that the most important component of case report writing is monitoring the clinical course of the patient. So that means the best time for writing your case reports is when the patient is still with you on ward. Yeah. So this is the time you're going to collect genuine data. Okay. Because if you can't collect a genuine data, trust me, what you're going to come up with might actually not change the clinical practice. And a very good case report that is publishable is supposed to be a case that can actually inform a proper clinical practice. Yeah, I'll also tell you what it takes to get a high quality figures, because trust me, Dr. Ivan is on call. We had our case aborted because we couldn't get a proper quality picture for one of our cases. So when you decide to write a case, please, journals requires you to have a very clear, crystal clear. When I say clear, high resolution images. properly labeled. I'm talking about annotation, properly annotated, showing the signs of interest, showing that sign of interest, because that's what the journal will look at. I will tell you that at the end of the day, the image that you're going to use should tell the other clinician before even reading the body of your manuscript. Just by looking at your images, should be able to have a clue of what your case is all about. That's how important is having a quality image or properly annotated image is. Yeah, let's go to the next slide. So I must tell you that publicity landscape has raised the bar so high. What do I mean by this? I've already told you that for you to publish high impact case, you must actually adhere to care guideline. This guideline is just a 13 items that every clinician or every researcher who is thinking to publish a case report should adhere to. And the reviewers, including me, when they send the paper to review, I first look at your paper and I see whether you've adhered to the care guideline. Because if you've not adhered to the care guideline, trust me, it's going to be rejected. Okay. Before 2013, this care guideline was released by some groups and adverts in 2013. But before 2013, there was nothing. But after 2013, all the journals require you to adhere to the care guideline. Failure to do that, your cases will be rejected. And as we talk right now, more than 1,000 journals has actually adopted it worldwide. So the talk of today, I'm going to talk about care guideline and its component, because the component of the care guideline is actually what is required in your case report. Yeah. Next slide, please. So what does it entail? Okay, this is actually reporting standards for all the case reports that you want to write. Okay, it composed of these 13 items. It's composed of title, keywords, abstract, introduction, patient information, clinical finding, timelines, diagnostic assessment, therapeutic intervention, follow-up. I told you, very important that for you to write a very high impact case report, please, you need a follow-up. I'm going to tell you a few cases we have published. You really need a clear patient follow-up. That's why a good case report writing starts from the time your patient is still with you. You're monitoring every change in the patient's condition and symptoms, and blah, blah, blah. Yeah. Discussion. In this under discussion, you're comparing your case to really the one existing. You're putting your case into context. Patient perspective. Sorry. So patient perspective is the patient's own word of how the case has been managed. Shall talk about that. It's really very important. Then informed consent. I'll talk about all that. All right, let's go one by one. And this case care guideline will tell us each individual subsection that's supposed to be part of your case report. Yeah, let's go to the next slide. Yeah, the first one is the title. I must say that me as a reviewer, when they're sending me a case to review, the editor sends me only the title and the abstract. They don't send me the whole body of the manuscript. So what does it mean? Your title is supposed to be interesting. Okay? Your title is supposed to attract attention, because that's where even the clinician will decide to read your case or not. So title is very important. So the title should actually signal to the reader and the indexers or the academia that this is a case report. What do I mean? At the end of your title, you're supposed to indicate a case report. I'm going to show you an example. Okay? And the case report should actually include that key clinical features that is of interest. Okay, like for example, if you're writing a case report with malaria and you want to explain maybe the severe malaria presented with cerebral malaria, you must say this is a case report. I mean, this is severe malaria with cerebral involvement, or in anything. Supposed to talk about that one thing that is interesting about this case report. It also helps in the in the discoverability of your database or the focus of your case. It's really very important. So it's supposed to be specific and concise. Please avoid these vague phrases like a rare case of. By the time you're writing a case report, it's already fascinating to you and your prospective readers. You're not supposed to exaggerate this. It's supposed to include the diagnosis and that one distinguishing element. you know, an age group, maybe setting or complication that you actually really want to talk about. Okay. So I must say that a good title is that very concise title, specific and informative. Okay. And is often structured in the form of a key findings to or a condition, the patient's type or context, then you end with a case report. So that's a good title. Okay. No diversity here. Okay. So that's care guideline number one. So a care guideline number two is the keywords. Okay. The keywords supposed to be between 2 to 5 keywords that capture the key elements of that interesting case that you're going to that you're writing. Okay. The keyword supports the journals when it comes to indexing and maybe even searchability of your case. Okay. So you really need to include the word key case report as one of the keywords. Most of the researchers always forget this. You know, the word a key, I mean, the word case report must actually be one of the 2 to 5 keywords that I'm talking about. Okay. So one of them should be the main diagnosis or the condition in question, the key interventions or the test in question, or the important outcomes or the unique features that you're describing in your case report. Yeah. So the third one is abstract. Abstract is a summary of you all manuscript or the case you've written. How I always do it, I write my abstract last because after writing all my manuscript, now I summarize what I've written, you know, and the number of words varies from journal to journal. Some other journals expect it to be just between 150 to 250. You see, these words are very few, but you're supposed to squeeze every important details of that case in an abstract, you know, because poorly written abstract might actually deter the reviewer from reviewing your paper. Remember, I already said that when your paper is being sent for review, the editor only send a title and an abstract, you know. So you really need to properly summarize your case. So you summarize under the sub-heading of introduction, the case itself, the patient presentation, and conclusion. As simple as that. Other journal expect you to write the key clinical take-home message as the last. Yeah. So that's how brief it's supposed to be. Yeah. That's that section of title and abstract. Okay, let's go to next slide. So these are some of the work that we have done with friends. If you were to see the first case, my favorite paper on Kunis syndrome, this case was from Nigeria. When I was contacted by this senior house officer from emergency, he told me, "How doctor, we have this case, and the patient was bitten by bees and present to us with severe body swelling, and now on putting the ECG leads, the patient is presenting with abnormal waves and blah blah blah. You know, the patient was in dynamically very unstable. You know, I've never heard of Kunis syndrome, but when I punched it online, it brought to me Kunis syndrome. I found out that Kunis syndrome has already been, you know, described by many researchers across the globe. But in this specific case, Kunis syndrome was presenting what we call the artery fibrillation and sac thinning in all our anterior leads after this thing. You see, now this is what makes our case different from the other Kunis syndrome that has already been published, because this one is presented with cardiac involvement, you know. Then at the end, I was bringing in the ethnicity. It's really very important. We're describing Kunis syndrome with cardiac involvement in an African patient. This is an ethnicity. The whole Kunis syndrome that I've been reading online, it was actually in a European country. So ours was very interesting and is a case worth writing because of this, you know. And at the end, I included a case report. So you really see how fascinating the title is. It will attract everybody's attention. People be like, "How we have read about Kunis syndrome, but we have never heard it being presenting with sac thinning," you know. So this one makes it very interesting. Another one, it was about cardiac tamponade secondary to massive pericardial effusion in severe primary hypothyroidism. This partial patient was being treated for the primary clinician was treating it as TB pericarditis or tuberculosis pericarditis. But when I went online and started reading about all this, I realized that it has been documented that TB pericarditis or tuberculosis pericarditis does not give massive pericardial effusion or tamponade. It just gives some, mild effusion. And especially in our setting where TB is very, very prevalent, every other clinician will actually treat it as TB pericarditis. You not think of the endocrine cause. So when I told this clinician to do thyroid function test, there was severe alteration in the thyroid function test. Okay, and that's how we came with hypothyroidism. So we concluded that this massive pericardial effusion was due to primary hypothyroidism. You know, and we wrote the case, and it was an interesting case. Then the last one, it was actually from Lacho from my friend Dr. Erickson Uni. This was actually one of the interesting case. This patient came in with gastric perforation, and of course, every clinician or surgeon will actually offer XLAB. When they explained to this patient the needs to do the XLAB, the patient accepted. But maybe during the time for operation, the patient declined consent, started questioning the importance of taking him to theater. They brought in the relatives, but still they declined consent. What are you going to do in that scenario? That's what they call the ethical dilemmas. They decided to let it go, and this patient died. So this is very important. This is very interesting because you're going to inform the readers or the academia what sometimes the surgeons go through. I mean, it was actually fascinating because this patient declined the primary need, for this surgery. Yeah. Then lastly, this is also my case on apical hypertrophic cardiomyopathy. This patient was being treated as hypertensive heart disease. After them doing a ECG, I found out that this patient really didn't have, it was not actually hypertensive heart disease. This patient was having a fascinating apical hypertrophic cardiomyopathy because all the other imaging reveals that. But still, because the clinician was having his preferred, diagnosis, even in the presence of these labs, the guy still want to treat as, hypertensive heart disease. This is what we call the anchoring bias in an African patient, So these are some of the first titles that actually catches the eyes of the reader. Yeah. Let's go to the next slide. Trial number 4 in the guideline, the thing that you should include into your case report is introduction. Please, this is just few lines, 1 to 2 sentences only. Remember, an introduction, you're not doing a literature review here. You're just telling people what makes your case interesting. You're just telling people what makes your case different from the one that already been published. What is unusual or novel about the case you're planning to write? You're going to cite few key findings, guidelines, and maybe, some important labs. Okay, you need to keep it focused. Okay, just some short paragraphs telling people about your case and what makes it really interesting. Okay, and you really need to state the purpose of reporting this case. Okay, like for example, to describe the rare complication, or to illustrate the diagnostic challenge, or to report unexpected drug reaction. That interesting part of your case report supposed to actually come on an introduction. Okay, so the specific knowledge gap or the reality of your case you're addressing in this. Yeah, so you really need to explain why this case is scientifically or clinically important to report. Yeah, so that's all that's all that you need to include under your introductory part. So there's certain things that you really need to avoid. Citing more than 3 to 5 references in this stage is not really advisable. You really don't need to bury your case novelty in this long paragraph, Yeah. So let's go to the next slide. Yeah. So these are some of the example of introduction that we pick from our cases. For now, I think because of time, we're actually going to skip that, but these are actually example that we pick. Yeah. I just want you to know what to include in an introduction and what not to include. Yeah. Let's go to the next slide. So patient information. You've skipped a slide. Can go back a bit. Yeah. Patient information. This is really very important. The patient information in this one is supposed to be identified. You're not supposed to talk about the patient's name or where the patient is actually being managed from, you know. So you need to identify patient demographics. Okay. So you can talk about the patient age, sex, relevant occupations, or the context. Then you need to talk about the patient's main concern or symptoms as the patient describes them. This is a normal issue taking that we do in clinical rooms. You need to talk about the relevant, when I talk about relevant, it's supposed to be relevant to the case you're describing, relevant medical, family, and psychosocial history. Okay, you're supposed to talk about relevant genetics, dietary, or lifestyle. Yeah. So you really need to protect the patient name. You really need to and facility identifiers. You really need to specificity that will identify the patient locally. You really need to protect the patients from the public because they're very important in this case. Okay. Obtain a measurement written for posting for drafting because the patient can take life. Sometimes you really get this interesting case, but the patient will be like, no, I don't want my case to be published. You don't need to go ahead and publish this case because
Excuse me, your volume is getting down. Could you adjust your position?
okay. So that's what I was trying to say. So when I talk about the identifying the patient's information, you really need even the patient's images. Okay, you really need to annotate well. The facility name, the patient's in identifier.
We are not hearing you clearly.
Let's go to the next slide. Yeah, these are these examples. You can do it later because of time. Let's go to the next slide.
But Dr. Nelson, we are not getting you clearly. Would you please come near to the mic or adjust?
Hello. Are you not getting me? Hello?
Yeah, kinda. We are getting
No,
you.
you are not yet clear.
Hello. Are you now getting me?
Yeah, better now.
Okay. Am I on?
Yes, you can go on, doctor.
Hello, Dr. Api. Kindly confirm. Okay, thank you. Thank you. So the next part of our care guideline is the clinical findings and the timelines. Yeah. So when I talk about the clinical finding and the timeline, remember I made a statement that the proper time for starting to write your case is when the patient is still with you on your ward, because you're going to be able to monitor these patients. You'll be able to gather all the necessary information to write about this patient. So when you talk about the clinical findings and timelines, you really need to collect all the relevant information because all the top journals require this. Like for example, I use this diagram to illustrate. Day 0, the patient presented to you with a chief complaint. Day 3, you examine something like that until the day for follow-up. So maybe like for example, like our patients of cardiac tamponades, you're going to see that on day 1, when we took the X-ray, the patient was having a very huge, pericardial effusion, what we call the bottom water sign, But at follow-up, when we repeated the X-ray, it has resolved. So all this happened because we were able to monitor the patient clinical course. And the journal expects you to then put in form of a table. I'm going to show what it looks like. From the time that the patient has arrived to you, up to the time you're making a follow-up until discharge. All those information supposed to be guided explicitly. Yeah. Let's go to the next slide. Yeah. So this is an example of the clinical course that I was trying to explain. Like in this one is what I call the diagnostic timelines. Yeah. So they're explaining everything, that happened to this patient until when the patient reported to them with the presentation of interest, you know. Yeah. So let's go to the next slide. Yeah. So diagnostic assessment. In this case, you really need to show the reasoning, not just the results. You know, at this point, I already said that when you're doing your word round, there's a lot of assumptions that we usually make, you know. But by the time you've decided to write your case, you should make sure that your patient has been explicitly investigated and the diagnosis is confirmed, whether by labs, whether by radiology, whether by pathology, but at least the patient should have a proper diagnosis. No guesswork here, because you're informing the world of academia of your case, you know. So in this case, you're going to report diagnostic method you use and their strength or limitation. You're going to discuss all the differential diagnosis, and you're going to rule in and out, you know, the presentation that, I mean, the condition that present the same way, you know. So diagnostic reasoning should include the challenges you encountered, okay, and the prognostic characteristic where possible. Yeah. So most reviewers, I must tell you that most reviewers flag this. It's a red flag to many reviewers. Like for example, there's a case, the guy presented it very well. He had very good pictures, but when it comes to interpreting the image was talking about something else. His interpretation was talking about something else. So we had to reject the case, and yet it's actually one of the powerful cases I've investigated. So it's really very important to interpret this case very well. One of the things that I really need to tell the people who are starting maybe to write case report is, in your writing a case report, the best thing you can do is, if you think the case is novel or fascinating, the best thing you can do is to consult the person who is good in that area. If it's a nephrology case report, consult someone who knows, because there are going to be a lot of interpretation, full interpretation. If it's cardiology, please consult somebody who knows cardiology, because they really need to help you review. I had my paper rejected because I misinterpreted it. So it's really very important to look after that. All right, let's go to next slide. Yeah. So you really see this one is actually from one of our case, the apical hypertrophic cardiomyopathy. So this patient had something which is very diagnostic, you know, of apical hypertrophic cardiomyopathy. This is what we call the asuspect appearance. You know, we're able to pick this up, and you know, it is very clear, and you rarely see this. You know, on top of other diagnostic criteria, our patient was having this, you know, and this made our case actually very fascinating, you know, on top of the ECG finding, on top of, you know, the echo finding. This is actually the echo finding, the strength pattern. We're able to even do what we call the spec tracing, you know, all these things. Yeah. So you really need, this is what we call the annotation. Before you actually submit your case for any review, make sure your case is actually properly annotated. And the annotation should actually show you or the reviewer the actual, you know, signs in question. You know, like this one, the apical hypertrophic cardiomyopathy. When you see this aspect appearing on echo, it's diagnostic, you know, on top of your ECG findings, you know. So you really need to annotate, and you cannot annotate this properly if you don't consult somebody who knows it, and could actually be the reason why your case is rejected. Yeah. So we really need to emphasize on this. Okay, let's go on. Next slide, please. Okay, how about the therapeutic intervention? In this case, you're going to explicitly explain how you manage your patient from the start to discharge to follow up. Because in this case, please, you really need to adhere to the guideline. Okay? Because if you're away from the guideline, you really need to explain why you did not give the patient treatment, or which are not compliant to the standard guidelines. You know, you really need to explain the type of intervention you're giving to your patient. The patient of our cardiac tamponade, we did synthesis, and the patient's hemodynamic status improved significantly. You know, ours was surgical. You know, though we also gave medicine like levothyroxine to these patients, but you really need to explicitly explain the type of intervention you've given to the patient from the start up to the end. Administration details. Okay? How did you give the route of administration, the duration? How was the patient response to the standard treatment you've given? So you really need to give the rationale for the change of interventions. And you also need to adhere. I've already said this. You really need to adhere to the standard treatment guidelines. You don't deviate. Yeah, because at some point you really need to tell the clinicians to 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 replicate. Actually, the purpose of writing a case report is to help the clinician replicate, or to guide clinician in the clinical management of the patient in case they come across. That's why they read case report. So you can't report something which is not to standard. Yeah. So the therapeutic intervention, you're going to explicitly describe it into details. Yeah. Next slide, please. So this is what I was trying to explain, like when we are treating our patients of cardiac tamponade. Remember, this we are giving the levothyroxine, and according to the, the society that actually I've forgotten, but these are the people who are endocrine society. Yeah, this is how they said, this is how they recommend the titration of the levothyroxine dosing. And for us, we really comply to this because we really want to inform the clinicians, and we have to include this in our case report. And that's what makes our case report, sensitive, you know. Then you need to justify after giving this what happened, and why. You really need to explain why you've titrated this the way, you've done it. Yeah. And we also at every stage of titration, we are repeating our hormones level to check whether the hormone level is actually improving with the titration. So it's really very important to justify some of this treatment. Yeah, it's supposed to be something clinician can replicate. Yeah, next slide, please. Yeah. So about follow-up and outcome, you really need to close this loop honestly, because trust me, the reviewers or the clinicians, they really want to know what happened after you practicing that guideline directed treatment to this patient. Okay, at follow-up, you really need to explain thoroughly. Did the patient recovers? Sometimes the patient can even die. You really need to explain. Okay, so the clinicians and the patient assessment outcome use that tool to use depend on the case you're presenting. Their scores to use depend on the case you're presenting. So you really need to do a very important follow-up test. I told you about our case of cardiac tamponade. We repeated the X-ray and we saw that the tamponade, we repeated the X-ray and we saw that the tamponade actually resolved at discharge, and that's what was the important follow-up labs, You really need to adhere and, adherence and tolerability for the follow-up period. This is maybe the patient's adherence to the treatment, yeah. So you don't need to skip the length of follow-up. You really need to actually explain it. So this is what I was actually trying to explain. You see, the first X-ray A, this was our case of cardiac tamponade. The X-ray A was showing you a very massive pericardial effusion. Okay, this is what we call the tamponade. Okay, and this is what we call the water bottom sign. This was at presentation. After treating the patient, giving the levothyroxine, after doing our pericardiocentesis, after treating the patient, we repeated the X-ray at this such, and this is what we got. And I believe you can all see the difference between these two X-ray. Okay, this was this as follow-up. The top reviewers, the top journals expect you to actually report this, and it's really very important. And then also at 1 month, we repeated the thyroid function test and it gives us that value, which was different from the first one. Then you also repeat at 3 months, the values are there, it's continue to decrease, okay, at intervals. They really expect you to describe those changes explicitly, because this is what they call the follow-up of the patient. Yeah. Let's go to the next slide. So this discussion, this section is really very important. It's really very important. This is where you are going to put your case under context now. So in this case, you're going to describe, your case as you compare it to other cases in the literature now, or the similar cases. Okay. Does it confirm to the cases that is already been published? Does it contradict to the case that has already been published? Okay. Does it extend the existing knowledge? So there's some of the things you should ask as you discuss your case, you know. So you really need to explain the rationale for your conclusion. Okay. Explain how you infer, maybe like if you're inferring maybe causality or maybe your association, you know, like you really need to explain it very well in this case. Okay. You're discussing the relevant medical literatures. Okay. And where this case fits. Remember, I told you sometimes the case fits within the relevant literature, sometimes diverges, which is also normal, but you just need to explain. Okay. You really need to explain explicitly, you know, the strength and limitation of your case. Okay. The detailed workups. Maybe you could not do a certain standard diagnostic test because of maybe limitation, you know, or you couldn't maybe do a proper follow-up because of certain limitation, you know. So you really need to also explain the strength of your case deeply. Okay. So you really need to avoid some of these things. Never claim causality from a single case, because this maybe you can do that when you're doing a case series. Don't always generalize beyond what one patient can support. Yeah. Remember, the thing that I didn't tell you when we are starting to present is case reports sits at the bottom of clinical evidence. It's at the bottom. That's why Ivan talked about it last week. It's at the bottom. Okay, that pyramid of evidence, case report sits down, but it's really very important that you need to take it out. Okay, the one that sits above is systematic review, but this one sits at the bottom. So you really need not to make a very funny conclusion from it. Yeah. All right, let's go to the next slide. Because of time, we're not going to talk about this now. Yeah. Let's go on. Patient perspective. I think we're almost done. Patient perspective and informed consent. This is not negotiable. Remember, I already said it earlier on that you really need to seek for patients' consent before submitting any case for publication. Seek for consent and seek for a proper ethical approval from your relevant bodies. Okay, so include the patient's own account of experience where possible. You know, like our case, the patient of Kunis syndrome, the patient told us he never knew that actually after this thing you can actually present with a cardiac problem. You know, and he was very happy that we were able to to save his life. This is the patient's own word. You know, it's optional, but it's really very important. Most high impact journal really recommend you to include it. Okay, it can actually be a short quote, you know, very short, and you really need to paraphrase the narrative well. Yeah. So, informed consent, you really need to state explicitly that written informed consent was obtained. I remember when I was still in year 4, we went to Lamore for our community placement, and I came for this regular ward round, and I met this 9-year-old being treated for malaria, but was having periwater swellings that has been there for quite some time. I mean, like maybe 5 days, but was not even resolving with malaria treatment. So when I asked online, and I found out it was actually called orbital compressor syndrome. You know, when I went online, you know, I found out that Dr. Lum Ronald had already written it about the case from Molago. But for them, they really, really investigated the case. They did CT scan. They did all the relevant investigation that's supposed to be done. But in that case, we had to write. You know why? Because in our case, we were actually writing it from a different setting altogether. That was from a refugee kind of, you know, setting with no complicated, those required diagnostics. You know, we actually tell the clinician that even without the CT scan or without these complicated tests, you can still be able to diagnose orbital compressor syndrome, even in your local setting, you know. But when I submitted this case online, I didn't cover the patient's face well. They had to turn it back, you know.
Housekeeping.
You really need to actually observe some of
Dr.
these things.
Nelson?
And you really need to state that the patient accepted that the photo can actually be shared online for publication. Yeah. So I already said that IRB most times is not required, and that's why it's easy to write case report and publish, because IRB steps cannot actually take so long. unless you're doing a case series and you're reporting many patients, and at least that case, you really need high IRB approval from your institution. Yeah, let's go to next slide. I think we're almost done.
Yeah, I think we
Yeah.
can give you some 4 minutes to wind up, and then we have some questions.
Let's go to next slide. Yeah, choosing a right journal for your case. I already talked about this briefly. You really need to see what fits your case. You can't just submit a GIT case to a cardiology case. All of them, they have their different audience. Probably, it's good. Not probably, it's going to be rejected. You know, the first thing that you really need to look for is the journal's impact factors. You know, where it's actually indexed on PubMed, because it's actually our house of our work, is a house of our work. So you really need to see whether that journal is actually being indexed in PubMed. You really need to check that your case actually adhere to the care guidelines. Remember, I told you all the reviewers look for that. Yeah. So some of these things we already explained why the case report get rejected. I already talked about the images to involve, you know, the proper resolution, the table, the figure legend, some of those things. Yeah, I think we have come to the end of our discussions, because I see the time is up. We are 3 minutes after 7. Yeah. Next slide. This one we can also skip. Thank you so much, Oz. I think I'm going to stop here. Yeah. Thank you so much for your attention, and thank you for the opportunity to talk to you all.
Oh, thank you very much, Dr. Nelson, for the insightful and practical presentation tonight. I'm really honored by your presentation. Thank you very much. At this juncture, let's welcome.
Maybe this is the time to now Q&A. Maybe in case there are questions. We have experts. I want to recognize the patient of Dr. Ivan, someone we have done quite a number of studies together. I would also want to recognize the patient of Professor Bongomin. Maybe he can also hide something when necessary. Thank you so much.
Yeah, as Dr. Nelson has said, we can allow 1 or 2 experts to give us a highlight or supplement on what Dr. Nelson has given us tonight. Thank you. Maybe we can have our dear patron, Dr. Bongomin Felix.
Yes, thank you so much. The organization U.M.A. and GOMREG for organizing this, and also Nelson for making this really very important presentation as a case on case report. I mean, as a doctor out there, there's no reason for you not to write a case report, because you see patients on a daily basis, and many of these patients will have the key characteristics of case report that Nelson has put across. So a case report could actually be, usually we only have 2 ways in which we describe interesting case reports for publication. So you could definitely have a rare happening that is worth reporting, and this could be at the level of presentation, at the level of genetics, at the level of diagnostics, at the level of treatment or response to treatment. So you can have rarities occurring around those points. But you can also have what we call rare presentation of common things. So you can have a rare presentation of malaria. You can have a rare. I'm here next to my friend Dr. Kui, and you know she's telling me she saw a case of a rare case of multiple myeloma presenting as rheumatoid arthritis in a paraneoplastic in a paraneoplastic pattern after 10 years of someone being treated with rheumatoid arthritis, and only to discover that it was a paraneoplastic presentation of multiple myeloma. So definitely, we have so many things that we can write on. And again, you guys are all aware, 1981, when the CDC reported in the weekly morbidity and mortality report, which is the CDC's journal, of these 5 apparently healthy individuals, mainly from the LGBTIQ population, who presented with oral candidiasis, features suggestive of pneumocystis jirovecii pneumonia, and Kaposi sarcoma. You know, just description of these 5 individuals led into the description of now what we call AIDS and HIV. So just a simple case series of 5, you know, made a huge description. The same thing at the end of 2019, 2019 December 20th, to be specific, you know, the paper that came out in the Lancet, describing 6 cases of atypical pneumonias that came out from Wuhan in China, you know, led to a description of COVID-19. So that tells you literally how important some case reports could be in unearthing very important health conditions as well. So I encourage everyone literally to get involved in publishing cases. I'm actually very happy with Nelson, you know, who has been a very good mentee, working closely with Dr. Riba in Lacho, and also Ivan Pitua and Ulum and Christopher as well, to you know, bolster and showcase how interesting case reports can actually be pulled from within Uganda, and also his collaborators in Nigeria who are on the call. Literally, when I was doing my M.Med here in Mulago and Chirudu, every rare cases that I could see, either on the ward in Mulago or in Chirudu, I could literally take pictures. So my work was really to take pictures. So, and I was able to describe so many cases that I published within my 3 years of M.Med. I think I published probably 15 to 20 case reports from just around Mulago Hill. And I mean, this could be just simple things like a patient presenting with pulmonary cavitary cryptococcosis, to very rare cases, maybe like VOC, Koyanagi, Arada syndrome. I think that was my rarest case report I got from Molago Hill. So that is how important these case reports are. And they are very simple to write. You only need the consent form from the patient or from their caretaker. And then you follow the care guidelines that Nelson has shown you. Very simple, very straightforward. You just need to include on the title that it is a case report. You summarize the abstract, 150 words or 200 words. You summarize the key clinical message in 75 words. You write the introduction in less than 200 words. You write the case presentation in a normal way in which you could flag a patient, presenting complaint, history of presenting complaint, past medical history, surgical history, ops gyne, all these past medical history, allergies, social history and stuff, and then how the diagnosis was made, what were the differential diagnoses, investigations, what were the treatment, what were the follow-up, and then the patient's perspective of their own illness, if you are able to interview them. And then, you know, you just summarize with the discussion, you know, what is the learning point from the case? How does your case differ or are similar from other cases? What else could be done? And then you just conclude. So literally, it is so simple to write a case report. It takes about 1,500 words to 2,000 words if the case report is too long or it is a case series. And usually you can write this over a weekend, which is probably our next presentation. Dr. Kajimu Jonathan is on the call, and I'm sure in one of this weekend, he will tell us how you can write a case report, how to write an original article just over a weekend. and many things of how you can. I know Dr. Pedun is on the call as well, Bernadette Pedun, you know, and how they, she worked very closely with our team to get about 7 case reports published within 1 year. You know, it's just so fast and so easy to do so. You could also be a Pedun, you could also be an Ivan Petua, you could be a James or Kema Nelson, and then you know you can publish this thing. And the good news is that you have us. You have uh, us here who have published maybe like 40 case reports and many other good colleagues who are on the call who can really support you to write these case reports. And then you get a publication attached to your name as well. So thank you. I would be interested to see any specific comments or queries that would come through. Otherwise, thank you so much, everyone on the call. Nelson, Joel, Dr. Riba, Api, and everyone. Thank you so much.
Thank you very much, Dr. Bongomin Felix, professor and my mentor. At this point, allow me to welcome and appreciate the presenters, the speakers of today. Please, you can kindly drop any emoji that can really appreciate our presenters today, just to appreciate. Please, let me see you do that for us. Any emoji appreciation in that way as we prepare our questions. Thank you very much. If you have any question, please, you can drop it in the chat box or raise up your hand to give your question. Thank you.
I think time is fast spent. We could give the guest speaker to summarize in at least a minute, and we close. And I also encourage members to register that attendance. We find that the attendance is high, but online link we have very few people. We need to see that the CME is creating impact, so we need the attendance. Plus, those who are also students who may not need the CBD points, we need the attendance. Please, I request Asuma you call the guest presenter to summarize in a minute, and we close.
Hello, thank you so much, Dr. Jael, for that kind words. I am really very honored and humbled to be here and for giving me the audience. I think I don't have much to say. Masses, I'll still repeat. If you're thinking of starting your publishing career, the best thing you can do right now is to start writing a case report. It's very easy. You've seen, Professor already talked about it. It's something that we usually come up with. I mean, every day that we see patients, there's something interesting about that case. If you really want to write that case, it can still be submitted. Something that maybe I forgot to talk about is you should really need to be aware that the case that you're going to write does not involve finger pointings. Like, for example, maybe you work in Lacho, then you're going to write a case that exposes Lacho, maybe substandard clinical work, like that exposes, maybe, I understand what I'm saying. So you really need to stop that. I really need to avoid these cases that highlight the substandard care. Otherwise, case report writing is really very important, especially for the people who are planning to start up their career in research. It's really advisable you can start from there. Thank you so much. Thank you for inviting me. I'm really very glad to be here. All right.
Thank you. Thank you very much. We see there's one hand up for Dr. Guang. Please, we give you some 30 seconds if it's a question.
Yes, thank you so much for this wonderful presentation. My questions are, I wanted to understand difference between a case series and a case report. That's one. Two, the presenter talked about tools and scores during the case follow-up. What did he mean here? Is it meaning the guidelines or? And lastly, there are issues of the IRB approval. So what approval or what ethical steps does one need to have the case, submitted? Thank you.
Yeah, thank you. And also, lastly, how do you contact the journal when you want to publish? So, Dr. Kema, you can communicate on that, and then we close our session.
All right, thank you so much, Dr. Ogwang, for that
Ogwang.
insight question. I've already mentioned that case report involve a single individual patient, and it usually does not require any IRB approval. But a case series involve more than 2 patients. And in that case, you're describing many patients, and many journals really require you to actually seek for ethical approval. That's what I've said initially. About contacting the journal, you really don't need to contact the journal in this case, okay? But the best important thing is to find a suitable journal that will actually accept your case report. I will advise that if you're looking for the journal, you really need to look for a journal that says case report at the end. Like, for example, I was talking about cardiology case reports, case report journal. There's that word case report always at the end of, the journal. So some of those journal is specifically designed to accept case report. You really don't need to write to them. Yeah. Thank you. So another question is about the tool. In this case, I was actually talking about sometimes you're managing your patient, but there are certain tools you're monitoring their progress, how the patient is progressing during the follow-up. Like, for example, maybe a scoring system. You're treating this patient, but then you're subjecting them to a certain scoring system that monitors their progress, their clinical progress on treatment. So you can use those scoring system to even, explain them in your manuscript that this patient, after giving this, was, progress maybe from stage this to stage this. There are very many scoring system that maybe pertain a specific case you're writing. Yeah, thank you.
Okay, thank you. Due to time, we'll be closing here. Thank you very much for attendance. We want to appreciate U.M.A for supporting Acholi branch. Every time there's a CPD, they are with us and also providing us the link. We thank you, attendance, those who continue sharing our links, those who continue asking for what is the next topic on our Twitter handles individually, from Dr. Ribadan, is on LinkedIn and also on Twitter. That's X. I'm also on X and also LinkedIn and also WhatsApp. Let's keep the fire burning. Let's share knowledge. Let's build groups that will improve patient care in the region. And from me to you, every Monday in radio patches from 12:30 to 1 p.m. U.M.A has been given airtime to be giving health tips. So for those who are able to reach the station every Monday, please get to my inbox. I'll share my number so that in case you have time, we forward your name and then you present. Right, thank you very much. Have a good night. Thank you very much, Dr. Bongomin, for supporting the team. God bless you.
All right, thank you very much for joining us tonight. I hope this session was resourceful and insightful for everyone. I would like to remind you about our Gumrek mentorship program, which is still open. You can apply, and our WhatsApp group has been the WhatsApp link has been put in the chat box. You can check it out, and let's continue to use research to build our better society. Have a good night. See you at our next event.
As you leave, please make sure you tap the link. Joy. Team Joel. Greetings. Wanafunzi.
It's here.
Mukibi. I'll be the last person to sign out.
Thank you. Thank you for organizing the session. It was a very good one.
As always.
I missed the one of last week. Last week I had a lot of movement in the field, so I missed.
Some nice earphone and you plug in.
I'll be looking forward to the next one again.
Yeah, every Saturday is now a policy for U.M.A Acholi branch. We'll be having something.
Nice. I'll be joining every weekend at least. Get some learning.
We really need to share experience. As you also connect, it's very important.
Get to know new people. Know what
And also you can go to U.M.A TV or Doctors TV. It was being aired live, so you can still get a full back attendance from whatever you've missed.
Nice. Yeah.
And for the previous one, you can go to Joel on YouTube. I was also streaming it live, so that means there's a copy there.
Okay. I also check that one.
Okay, please.
Thanks. I'll sign out.
Ciao.
Ciao.